President Obama, in his budget that he submitted a few weeks ago, made a promising start. He proposed $1.1 billion in new funding to law enforcement, to folks who are involved in treatment, whether it's detox centers or treatment programs, whether it's programs for education and prevention, because we know from talking to people in the field, you need to get as early and quickly to young people to make sure that they understand that this pathway, which has exploded across the country, is something that people need to know about and to avoid. In New London, Connecticut, where this event occurred that I described, over the course of 2 days in February, we had a summit involving law enforcement, providers. We had the Director of Drug Policy from the White House, Michael Botticelli, come in. And again, the good news is that there's a lot of good work that's being done at the local level, not just in New London County, Connecticut, but all across the country, where people understand that this is a problem that requires everyone working together in all those factions and all those sectors. But the fact of the matter is that President Obama's proposal is not till 2017. We need help now. We need to get an emergency appropriation just as we would if there was a hurricane or an earthquake or a wildfire that was sweeping across different regions of this country. We need to understand that emergency appropriations for our military, which the Speaker and I will be voting on together on the Armed Services Committee shortly, that this problem, which is affecting thousands of families and resulting in fatalities for people, again, who follow a pathway that through legally prescribed medications needs to be addressed, and we need to get those resources out to people as soon as possible. I have a bill in the House that tracks a bill that Senator Shaheen in New Hampshire, another state that has been hit hard by this problem, that provides $600 million of emergency assistance, again, allocated to police, providers, education, and prevention, that is this week going to begin consideration in the U.S. Senate. It has been endorsed by law enforcement groups. It has been endorsed by people who are in the field dealing with this problem, who are dealing with families that can't get beds in detox centers, that can't get beds in treatment facilities, with police departments that are trying to get Narcan so that they can save lives, a miracle drug. But the fact of the matter is we need everybody involved, particularly the Congress, to help communities solve this problem. Last week, the National Governors Association, Republicans and Democrats, convened in Washington, D.C. to talk about their priorities. This emergency funding was their #1 request to Congress, because they are the ones at the front lines that are being confronted and forced to deal with this issue. We have an opportunity to listen to the people who know what they're talking about, to just drain away the politics and the partisanship, and understand that veterans, people living in rural communities, people living in suburban communities, people living in urban areas of our country are getting hit with this problem. And just like any other disaster, we as a nation need to come together to address it now, and not wait for 2017, now to pass this measure. We can do more in terms of reforming the protocols that the VA and DOD and the civilian healthcare sector, frankly, have gone too far in terms of overprescribing. We can do more about disposal of drugs. And Walgreens, to their credit, have set up disposal sites all across the country where people can come in with excess opioids to get rid of them safely. The fact of the matter is that the willingness is there, but the resources are not to deal with a problem of this magnitude. Let's pass the Shaheen-Courtney measure. Let's get emergency funding to the folks who need that help and who are ready. They are on standby. They are there to help those families and those individuals who need the help that we as Americans should come together and support. I yield back, Mr. Speaker.